Hi, good afternoon, everybody. This is Eric with American Business Systems, and we're welcoming you to our Wednesday webinar. We're going to be talking about the best business opportunity in America, the fastest way to build your medical billing business guaranteed. So, folks, hopefully you'll certainly get a lot out of this one because it's normally what we've been doing here lately is just been talking about topics about ICD-9s and a lot of things that are in the news considering you looking into getting the medical billing. But today we're just going to really work on our entire package today. So Patrick and I are going to go through that. So that's what we want to do, and hopefully you'll really enjoy it. We want to make sure also that you're going to be asking any of your questions that you want to. Again, if you've never have met any of us, my name is Eric O'Shea. I'm the Director of Research and Development here at American Business Systems. Now, let me introduce you to our founder of American Business Systems, Patrick Phillips. He is an author. Some of you already know this, but he has authored a couple of books, several magazine articles, and I'll show those to you here in a moment. But here are the two books that he has authored: How to Reprogram Yourself for Success and The Cash Crunch to Cash Flow book. Both of these books are available on Amazon.com, or you can give us a call here. We can certainly arrange to get you a copy. I'd love for you to have a copy of these, so just make sure you contact us, and we'll see what we can do to arrange and get you a copy of that. Also, Mr. Phillips is on the editorial board for Billing and Coding Magazine. Now, this is a magazine that goes out not just to ABS licensees. This is a nationwide magazine, professional magazine that goes out to several thousand medical billing companies, or hundreds of medical billing companies throughout America. And he is one of their sponsored people who actually do the writing. Like I said, he's on the editorial board for there, and they're always requesting more information from Mr. Phillips. So, listen, let me get him on with us, and it's good to have you here this afternoon, Patrick. Thanks for taking your time out here on this Wednesday afternoon with us.
Well, you're welcome, Eric. This is going to be I think, a great webinar, just because for folks who have not really in depth searched out what our opportunity is all about, we're going to cover it kind of in a generic way, and yet show as much as we can in this 1 hour webinar. So folks, if you're ready to ask questions, you can start typing those anytime you want to. We kind of monitor that. You'll see us looking down here at the little control panel where the questions are from time to time during the webinar, but we'll be monitoring those and answering those in the order in which they come in. So you can ask anything you want about anything about this business. It's a great business, isn't it, Eric?
It is. I love the business. I've been with in this particular business now for 7 years, and it's just wonderful being a part of this. And folks, like Patrick just said, we want to hear from you. We already have a question that's already come up, and let's go ahead and address this one because this is very interesting.
Okay.
Eugene is asking the question. He says, "Hey, I'm sorry to interrupt, but is the seminar for residents of Fort Worth, Texas only? I no longer reside in Texas." No, this training, the week-long training is for everybody. We just have it here in our corporate headquarters here in the Fort Worth area. So just come on down. We've got a good group of people already coming for next week as well.
Yeah, you stay right there at the Marriott Suites Hotel that you saw there in the picture earlier. And it's a Monday through Friday training, 8 o'clock Monday morning all the way till 5:30 every day until Friday, which is, we let you out a little bit early to get home there early. But yeah, it's a lot of information to cover in that week. Well, let's talk about why this business is the best. Well, we're kind of prejudiced, right?
A little bit.
We think it is the best business opportunity in America. And a lot of people, many of our licensees would agree with that. But here's one of the reasons why. There's a book that you can find out there called Prepare to Be a Millionaire. This is 43 millionaires in 7 different industries from all across the nation that have explained why they think that their business is a good business to be in. Well, here's one of them right here, Dan Newman. You can see he calls himself a medical reimbursement specialist. That's basically what you will be if you join us as an ABS licensee. And he says for the next 10 years, the medical industry will be the most wide open field. Every doctor, dentist, hospital, and clinic has trouble collecting money from their patients and the insurance companies. I believe that over the next decade, so much money will be made in this particular industry that it will blow you away. And Eric, we've seen that happening already, haven't we, in our industry? Just in the past few years, it's just exploded for some reason.
It really has. And again, I'm gonna go ahead and address one of the questions here because Alex is asking a question here, And I think we can address it while we're on this screen and maybe the next couple. But Alex is saying, my fear is getting started and setting up new clients. How can you make my fears go away? I think what Patrick just shared with you is that not only is there a market for your type of services out there, but I think you can see that you're able to make a good amount of money at this as well.
Yeah, there's lots of money to be made at it, and we'll show you how. In fact, it might be interesting to go ahead and kind of give a little preview here. At the end of this webinar, we'll tell you about next week's webinar, which is going to be in-depth, how to market medical billing services to doctors. So that kind of applies there to what John just asked. Okay, so here's one quote that we got from what's called the Black Book Rankings. I know that's probably tiny on your screen, but it's right down here. Let's see if I can get my little tool here working, Eric. Can I draw with this thing? Let's see. Oh, look at that. Yeah, blackbookrankings.com is a website that does all kinds of rankings about all kinds of topics and industries. But for this particular one, it says of all the physician practices, and they're saying 1 to 5 doctors. That's, a small practice. Actually, many of our licensees have doctors with 20 and 30, 40 doctors. But anyway, with employed billing staff, hope to outsource their billing in the next 12 months. Eric, that's what we teach people to do, is to help the doctor get educated enough to where they want to outsource, isn't it?
Exactly. And again, going back to Alex's question about his fear of getting started, Alex, we know because of the amount of doctors that are out there, and you see this statistic is from Black Book Rankings, 42%. So you're talking a good amount of doctors out there who are looking to already outsource their billing in the next 12 months. And this was a survey that was done this year. So this is going to go well into 2015 here for you. So, and we help you every step of the way. So, Patrick, why don't you address real quickly, because there are several questions coming in here that with this answer I think will help bring a good understanding. But this is the reason why you don't need to know medical billing. We have 20 years of experience and a support team that's going to help you do everything that you need to do to get your medical billing business going.
Yeah, look, anybody could get a medical billing business started if they do enough research and spend enough time on the internet, download some courses maybe and some coding books, and maybe take a course at your local college. There's lots of ways that you can get this business going. Folks, we charge a licensing fee that covers everything because we've already been there and done that. We've got the T-shirt. We have basically put all of our knowledge that we've gained over the last 20 years into our package so that you don't have to recreate the wheel. And that's why you don't have to know, like Eric said, you don't have to know everything, because we know everything.
Or we know people who know everything.
That's right. And if we don't know it, you don't need to know it.
Right.
All right, so let's see. Oh, I got to go back to my cursor here. I forgot. I'm trying to go to the next slide. All right. Now, here is another great quote from Entrepreneur Magazine. Most of you have probably heard of Entrepreneur. They've been on the market now for 35 years, I guess. And look what they say here in this. This is interesting, Eric, because they're pretty solid as far as an organization goes. I pushed the wrong button there. And they say that interest in healthcare franchising and the regulatory and administrative challenges that the sector faces spawned the Franchising in Healthcare Conference, which had its first meeting in 2011. Anyway, here's the bottom line is health spending is projected to reach $4.5 trillion by 2020. And Eric, that is a lot of money. All you need is a little tiny piece of that 4.5 trillion to make a good living at this, huh?
Yeah, absolutely. And what's interesting about Entrepreneur Magazine is everybody knows who they are. And so why we're showing you this is showing you that it's not Patrick or me or anybody you're dealing with here at ABS that's just kind of making up these stories here. It truly is. This is what the industry leaders are saying about healthcare and about franchising or the business opportunity or just getting right down to the medical billing business. Like the statistic we showed you just a moment ago, 42% of doctors looking to outsource. So folks, the reason why we're doing this is to truly show you and establish you why it is a good business for you to be a part of. I mean, market analysis also tells you that 24 cents out of every dollar are wasted in just simply administrative and billing expenses, according to the New England Journal of Medicine. Patrick, that's a lot of money when you start to look at things.
Well, it's a quarter out of every dollar that the doctor brings in, folks, is spent on the paperwork inside their office. So if you're wondering why some doctors are struggling right now to stay in practice, it's because of the wasted money. Look, guys, their core competency is seeing patients. They shouldn't be focusing on messing with all the insurance billing. That's something they can turn over and outsource to somebody like yourself once you've been trained to do that. Just like they outsource their maybe all their legal stuff to an attorney, all their accounting to a CPA, their window washing, they don't do that themselves. They outsource a lot of their transcription is outsourced usually. So this is just another one of those things they should not be doing in their own office, and we can show you how to prove to the doctor that you can do it cheaper.
Exactly. I mean, if you think about it, if you're charging anywhere from 6 to 7 to maybe 8%, you're really talking about 6 or 7, 8 cents per dollar at that point, other than the 24 cents as we're seeing there. So
yeah, because most of our licensees are charging on the money that's collected for the doctor a percentage, like Eric says, anywhere from 5 to 8, 9%. And so whatever that percentage is a whole lot lower than this is 24%, right? This is 24%, 24 cents. Okay, here's another quote. Oh, sorry, go ahead.
Oh, go ahead.
Well, I'll let you say his last name, Dr. Vern. He was interviewed in U.S. News, and look, here's one of the quotes he says. To get paid by the insurance companies, I have to pay about $20 in administrative costs and the fees to collect it, between the person, the bills, the computer system, the ongoing support, and so forth. It costs about $20 per claim. Now, folks, if you're charging only 6 to 8%, let's say an average of 7%, that's only $7, right? On the dollar for collecting the same money that the doctor's paying $20 to collect. So this is why there's a huge need for this. Eric, we have that asked a lot, of course, by people who don't know what this industry is all about. Why would the doctor outsource to you? Well, one of the reasons is he can cut his costs in half or in thirds.
Exactly. And John asking a question about, on what is the percentage being paid upon? Is it being paid upon what was actually billed or what was actually received?
Yeah, collected. Right. I just said that a little while ago.
Exactly.
It's on the money that's actually collected for the doctor. And as you'll see, we have a very small amount of money that's never collected, primarily because maybe the patient wasn't even eligible for that claim to be paid. But it's less than 2%. So anyway, out of $100, we're collecting, let's say, $98, and you get 6 to 8% of the money that's actually collected.
Exactly. There you go.
Yeah.
All right.
So slide. Isn't this talking about how much money they can make, right?
Exactly. So, folks, if you haven't been out to our website, you can go there and under Income Potential, click on Medical Billing Income Calculator. So let's kind of discuss that real quickly, Patrick.
Yeah, when you do that, you'll be able to fill in some numbers here, and we've already got some numbers actually filled in here just so you can see how this works. But anyway, you put in the number of doctors that you'd like to have as a client. You put in the number of patients that you think those doctors see each day. Some doctors can see 30, 40, 50 patients a day. It just depends, but we've got some low numbers in here. And then we've even got the number of days the office is open per week, assuming that the doctor actually works all 5 days. So we've even put in a low number here now. For this illustration, we put 6%, which very few people charge 6%. But anyway, if you did, the average claim is $100, we're saying in this instance. Again, it's just numbers that you can plug in. And when you hit the submit button, you'll actually see, as soon as I hit the right button here, you'll see this page here, which tells you that this is actually the amount of money that you're collecting for yourself. This is the gross amount of money that you would be actually getting in income from this one doctor. That was for one doctor, Eric, so it mounts up fast, doesn't it?
It does, and what a lot of people ask is, so how many doctors can I handle? I like to say, just if they're going to do it by themselves and it's just them and maybe another family member, you can probably handle anywhere from 3 to 5 doctors alone. And so you can see how this can escalate up pretty rapidly on an annual revenue for you. I mean, even if you had 3 doctors, you're just under $100,000 a year working 3 doctors. So, and that's pretty good living, and that's usually, Patrick, right about a part-time, work on an everyday.
Yeah, that's
45
not
hours.
it's certainly not 40 hours a week, right?
Right.
For one doctor. Maybe for 3 to 5, you'd be putting in that much, but by that time you're making a whole lot more money too. And folks,
Exactly.
We have licensees. If you go to our blog on our website, you'll see past interviews with licensees who say that they've got 15, 20, 30 doctors. So you're not limited to how many doctors you can sign up because we want you to sign up as many as you can. All right, now let's see why. Another reason this is a great business opportunity, folks, the best in America, is because here's what a doctor, we just talked about doctors' in-house costs, and here's a good illustration we came up with. Let's say you had an average doctor here that had 400 claims per month. Now, in a year's time, at $100 a claim times 6%, you'll be charging the doctor only $28,800. But look what the doctor pays if he's doing this in-house. He's going to pay a whole lot more than that in the employee's time. Then he's got payroll taxes and workers' comp insurance and errors, omissions and insurance and training costs and leave coverage and employee benefits and hardware and software support. He can spend as much as $65,000 in a year, folks, to do exactly what you're going to do for the doctor for, what is that, less than
a third at least, almost a half.
Yeah.
But 48% less to outsource it than it is to do that in-house. And Patrick, this is the funny thing is a lot of doctors, I mean, they always want to try to keep their cards close to their chest, and they say, oh, I do my billing in-house, and whenever I've done my calculations, it's only 2 or 3%. What we teach you as a licensee in our week-long training is how to do what's called a practice analysis. And this is where these numbers have come from, is when you're doing a discovery in a doctor's office and you're really drilling down on some of these things here. This is some actual numbers from one of those. So this is what we actually get to present back to the doctor.
Yeah, and folks, the kind of money that we've been talking about here that you can earn from one doctor is not all the income you can earn, because that's just for the medical billing. Folks, we have auxiliary services that if you go to our website and do some research and go through our virtual brochure, that will tell you about other services that you can offer to doctors. And Eric, some of these have made licensees a full-time income in and of themselves.
Correct.
Let's give an example here. One of them that you see here on the screen right up here in the upper right-hand corner is the what's called CodeWrite. CodeWrite is a service that improves the reimbursement rates for doctors up to 30%. That's because sometimes they use the wrong codes. Everybody knows there's codes involved in medical billing. Well, when the doctor is using the wrong code, he could be getting underpaid.
Right. And this is where let's really reemphasize this, is that this is why you don't need to know anything about coding, because part of what you're going to have here as part of one of your suites of services is this CodeWrite. And we got this quote from a gentleman that owns a coding company, Mike Inger. He says the average physician could increase their monthly billing by up to 30% if their medical coding was done accurately. So even the people who are responsible for the coding, which are the doctors, even they're not doing it right, Patrick.
Yeah, and the sad part is that his staff is not really that concerned about the amount of money that's brought in, because it doesn't really affect their income. Now, with you, since you're getting a percentage of the money that's actually collected, you're going to be much more focused, right? This is why doctors who are smart do outsource their billing, because they know that by paying you a percentage, you have an incentive to collect more of that money.
Exactly.
One of the reasons we're the best business opportunity in America, Eric, is because we have our own clearinghouse. Let's talk about that for a second. Let's explain that a little bit.
Yeah, and I think if there's anybody on the call today or going to be listening, you may know that there is something that, as what's known as a clearinghouse. And what a clearinghouse is nothing more than a third-party company that will take those claims, process those claims, and get those claims in a position to format those into each of the places of the insurance companies where they need to go. So we're illustrating that on the screen right now. So you've got a piece of software, as you can see there. That claim gets generated, and then it gets sent over electronically to the clearinghouse. The clearinghouse does their things, and then finally it gets over to the insurance companies, that claim. This process can take anywhere from 2 days up to a week's time of getting that information over to the insurance companies.
Yeah, now let me point out too, folks, if you hadn't caught it from this illustration, this is other software systems. This is not ours. We're illustrating what normally happens with other systems that are out there. Because other systems, this is the scary part of this, folks, because of all that the clearinghouse can do there, those claims can be rejected before they ever go even to the insurance companies. And then when they get to the insurance company, even more of those are rejected. And that's why we have this quote here from the American Academy of Professional Coders that says, industry experts have found that the average number of rejected claims for a medical practice averages around 34%. Eric, that's a third of all the claims that are sent in through a clearinghouse that get rejected. Now, we know what happens when those get rejected, don't we?
They sometimes never get refiled.
Yeah, because let's face it, those poor folks in the doctor's office behind that bulletproof glass, they're sitting in there doing a dozen other things, including helping the doctor see more patients. And so they get bogged down in this, even though there are some rejections. They go, oh, I got another 40 claims to do today. So they focus on the current claims and kind of forget about the others. I mean, they do get checks every day, every week, from different insurance companies. So to them, there's income, right? Even to the doctor, he goes, oh, okay, we're getting money in. What he doesn't realize is he's only getting in 66%.
Yeah, and the interesting thing about this, if you kind of put all this together of what we've shown you so far, we've already shown you that the claims that do go through, they're not getting everything that they could get because it may be coded incorrectly. Then all those claims that are sent out there could become rejected and never get paid.
Yeah, if you think about it, the way our medical system is set up for doctors is the insurance companies, like this quote says, dictate which doctor and which medicine and which test and how long in the hospital. They've planted themselves between the patient and the doctors on top of the money pile. And guys, we come in and rescue the doctor from that. We get him involved in that money pile and get him more of that money faster than he's ever seen it before. This is why they're thrilled to pay you the percentage that you charge. It's going to cost them less than having their own staff do it, as you saw earlier, and they're going to get more of that money from the insurance companies than they've ever gotten before. They absolutely love our licensees.
I'm going over to the questions here, and we quoted a source there. So Tally, you were asking what is the source of this chart. Remind us what chart we're looking at, and then we'll source that out for you. All right, so Patrick, let's talk about our clearinghouse now being embedded into iClaim. This is what makes our system so different than everybody else. So those that are looking to become an entrepreneur in this business, here is your biggest takeaway of the entire webinar. It's because our clearinghouse is built directly into the billing system. Right.
Folks, we don't send this to a third party. Our system takes and massages those claims and reformats them so that data can be sent directly from our system directly into the insurance companies. There is no third party. So if a claim gets rejected, guess what? Nobody can say, oh, it was my fault, it was their fault. The buck stops here with our system. And since our system nationwide has less than 2% rejection, we know that we're in control. Now, I know that there are some companies out there who say, well, if you get involved in medical billing, you want to set up your own clearinghouse. You want to pick from the dozen or so clearinghouses that are out there. Folks, that may sound like an advantage, but it's really a disadvantage because you have no control, and you're certainly not positioned like we are with our clearinghouse built into the system to know how to get those claims through and get them paid for the doctor. That's the big advantage.
A huge advantage, folks. And if it'll help you understand a little bit better, We will actually do a demonstration of that, what we're talking about here, because sometimes you can't grasp everything on a webinar, and especially sometimes when you're listening to it. So we can actually demonstrate this to you at any time. So just let us know, and we'll help you with that.
Yeah, absolutely. Okay. Eric, here's another reason why this is the best business opportunity in America. It has to do with these codes that we mentioned earlier. Let's talk about codes and what that's all about.
Exactly. Matter of fact, last week or the week before last, we actually talked about codes and why everybody's kind of shaken up, including the doctors. What we're showing you on the screen here is what's called a paper super bill. It is, or in what's called an encounter form, and you can see on there that there are descriptions and then there are codes. We'll take that first one right there, a 241.0. non-toxic, whatever that is. Okay, I don't even know what it is. All I know is that there's a code for it. If we were looking at this and actually doing the billing, what you would have seen is the doctor circle that or underline it, just like what Patrick's doing right there, and you would take that code and input it into our billing system. Now, what you're looking at here is the ICD-9 codes. Patrick was showing you just a minute ago that there is a code, the new sets of codes that are coming out called the ICD-10s. Here is a window of opportunity.
Oh, boy.
Next October, I don't know if you've got that next screen coming up there where we can kind of explain that a little bit better, but folks, just in less than a year now, all these codes that you see on here, all the codes that the doctors are currently using are all going away. This entire book.
Yeah, and currently there are thousands of codes in this book that the doctor uses to find his codes. And by the way, they provide these codes for you, as Eric just said. You don't have to know the codes because they'll send them to you on that super bill electronically through our system. And there are thousands of them. In fact, Eric, I think the new ICD-10 codes, there's quite a few more than there are now with the ICD-9, aren't there?
Oh my goodness! I mean, we're going from what you see there from 13,000 to 68, and actually there's even more than that. So, can you imagine the doctors in trying to get a hold of their billing, making sure that they got their current right codes right now, and then within less than a year try to learn more codes and forget about the old codes? Because if they mark the old codes and give that to their billing company or their office, Patrick, they're not going to get paid at all.
No, they have to be using the ICD-10 codes starting next October. So, folks, this is why we call it a window of opportunity. For you, you couldn't find a better time in history to get involved in this business, because the doctors are all looking at that change in the coding as something that could cut their it could cut their income in half if they don't know what they're doing. And if they don't have the proper codes in there. Well, guess what? Most software systems, they don't have the codes ready. Ours has it already built into it, as you'll see here in just a second. First, let's talk about what it's going to cost a doctor to get that implemented in their office, Eric.
Oh my! We did this statistic. I mean, this showing this just a few weeks ago as well. Let's just take the one typical small practice. Now, you can see down there a typical small practice is going to be possibly 2 providers, 2 doctors, and a staff of 3.
Right.
So that's very, very, very typical, as you'll see. You will find out to just get them educated, about $2,400. To do the process analysis, another $6,900. Change that super bill, that piece of paper that we showed you a while ago. If they're owning their own system, it could cost them up to $7,500 just to take the old codes out, put the new ones in, all the documentation costs that go along with that, and on top of that, there's, again, what's called a cash flow disruption. Could be $83,000 just for a small practice of what it's going to cost them to implement these new codes.
Right. And you can approach them and say, you know what? You don't have to worry about any of these costs because we've got that built into our system already, and we're going to illustrate that and prove that to you. And we prove that to the doctor, by the way, by going through something similar to this when we do the live demos for the doctors, as we'll talk about here in just a second. So let's start with this screen right here, Eric, because this is the screen where you start when you do a demo of the system, isn't it?
That's correct. Yes, this is the landing page of what's called iClaim, and iClaim is the platform which you do the billing and the scheduling and everything else for the doctor. You can see here we are gotten into now the EMR system, and we're demonstrating here for you is that not only do we have the ICD-9 codes there, but we also have a button there for the ICD-10 codes. Now, why is this important? It's important for you to be able to demonstrate to the doctor, and we'll be the ones demonstrating it for you as part of your support mechanism here at ADS. We will demonstrate to the doctor that we're already ICD-10 ready and can already help them change those super bills from their old codes of ICD-9s to the new codes to the ICD-10s. And we've input just a name there called fractures, and we're going to look at all the codes that we're looking at right there are ICD-9 codes. So you can see us pick up the word fractures there.
Yeah, so we can actually search for a keyword. I should say the doctor can, using our EMRX system on his computer or his iPad. And once he does, he finds all the codes that are already built into the system there.
And now this is really bringing it down into a very specific type of fracture. And for one, you can see the top one, that's the ICD-9 code. And you can see that there's 4 different codes now that could be possible for that one code of what the doctor used to know as an 82382. Now it could be this S82402A.
Right.
So, it's going to change, and the doctors aren't going to remember this.
That's right.
Our system is so intelligent that it will help not only, like you're seeing, where it's going to map this for the doctors, but as they go through their encounter with their patients, it will actually give them the new ICD-10 codes without them having to learn them.
Okay, Eric, there are literally dozens of questions coming in. Why don't you focus on you pick out the good ones there that are coming in, and I'll go ahead here with the slides. Okay, so here's another reason why this is the best opportunity in America, folks, because our system is the only one that has insurance verification built into it. Now, you may have heard the term eligibility check, for example. So insurance verification is where we in our system are checking to see if the patient is eligible to be paid. Look, do you know how many times a doctor sees patients and that patient is not eligible, therefore he has to charge the patient, and guess what? He doesn't collect but about half of all the money that's billed to patients. So he's losing even more money because he didn't realize that the insurance wasn't covering that particular procedure for that patient. If you'd like to see visually how insurance verification is done, I'm going to show you a picture of it right here. That's right. They get on the phone and they call up the insurance company. And Eric, I've heard them say they can sit on the phone here 15, 20 minutes before they even get connected to the right person to answer that question.
That is correct. I mean, just imagine, Patrick, there are some offices that have employed an individual, and that's their only task.
Yeah. And so here's an article we found on fiercepracticemanagement.com that says that office staffers spend at least an hour on hold with the insurance company to verify that the patient's coverage is effective and that the premium is paid.
Exactly.
So we're not just making this stuff up, folks. I know it seems like that sometimes because we got so much information we pour out at you during these webinars, but that's the facts. The facts are that they're going to spend a whole lot of time, and they don't have to do that on our system at all. Oh, sorry, there's the zoom in of that quote. There it is. Okay. So, Eric, here is a screen that's a kind of a zoomed in version of the screen we saw earlier, and I did that so we could actually talk about what they're going to click on here, which is the eligibility check.
Yeah, this eligibility request is, again, here's the key element, everybody. Understand, it's the clearinghouse. The clearinghouse gives us this capability because, remember, we can directly connect to the insurance companies. With that capability, we can click on that button that says eligibility request. It'll bring up this screen that you're looking at right now. From there, we select the payer, or the doctor's office could select the payer. It doesn't matter who does that. It could be Aetna, it could be Medicare, it could be United Healthcare. Put in a subscriber ID or whatever that particular insurance company is looking for. Click on Submit Transaction, and it comes back with the information that you're looking at here on the screen. Once we have this information, not only can we pull in that we have the name of the patient, we can also see their copay, but with one more click of a button, we can literally create an entire patient chart without anybody having to type in the patient's name. Now, if it was hard to follow, it's really easy. Listen, we're going to go to the insurance company. We're going to collect all of the patient's information and then bring that information into our system and create a new patient profile in our system without ever having to put in any of this information.
Yeah, this is just a screenshot of what we're talking about here, but all this information that you see here, member information, that was all brought from in real time from the insurance company's database. And it's not just what you see here. If we could scroll this, if this were live, you would see that there's just a ton of information that's brought in from the insurance company. So that's why our rejection rate is so low, folks. One of the reasons is because this data is from the insurance company. We don't have to type it in. There's no human error here. It's from the insurance company, so we know it's accurate.
Exactly. So, and that will help reduce those claims from ever becoming rejected. Matter of fact, in real time, you can see that there are little color codes here. You can see the little eligibility legend down there at the bottom. Patrick is circling it. It's pretty easy to understand who's eligible with their insurance and who's not. And this is on the doctor's scheduling mechanism that's built right into iClaim. It's all a part of what they're getting. So clearly you can see, like Joyce Tyler, she has a yellow button there. That means that insurance is not found on her record. Dave Davis, there's a gray button there. It's showing that that's probably a cash pay patient. And if any of those other buttons were red, that would just show that they're inactive. So it is letting the front office know, front office, before the doctor sees this patient, let's get that done and fix this problem now, so we don't have to go chase the money down after this patient has already left the office.
Right.
So Patrick, if you understand how costly it is to go chase money, what we're able to do right now is avoid that and eliminate that for a doctor's office.
Yeah, some of those costs that you saw in that chart that we showed earlier for the doctor's in-house costs, that's where it comes from, folks, is them chasing after the insurance companies to make sure that these people are covered. In our system, red means stop and green means go.
Exactly. That is exactly right. Yeah. Patrick, we have a ton of questions coming in, and we got 15 more minutes. I want to try to get a couple of these. Aaron, you're asking a great question here, and it's one that I know Patrick and I want to address with you, because a lot of people ask this. Prior to becoming a licensee, a lot of people, Patrick, like to do some market research in their own areas to find out if there are any doctors in their area that might need those services, or are there any research that's done on private practices versus doctors being affiliated with possibly a hospital? Do we have any information on that in different areas? We don't personally have that information, but again, if you go back to Black Book rankings, a lot of that information has been done nationwide. So if you see that 42% of doctors that are looking to outsource, that's where that information is, and that's where we get that from. But I also want to caution anybody out there that might try to go pre-market this business before they actually come to training. You want to address that real quickly also, Patrick?
Well, we've had that happen in the past, and what happens is when people go out there that haven't been through our training, they don't know the answers to the questions, they kind of look foolish when they start talking to a doctor about this business because they don't know what the right answers are. We give those answers to you during the training and give you all that you need to go out and talk intelligently and sound like you know what you're talking about. And when they ask a question that you don't know, we'll teach you exactly what to say to position yourself as a part of our nationwide network of hundreds of medical billing offices from coast to coast. We do thousands of claims for hundreds of doctors every day. So anyway, we'll position you in the correct way. So yeah, we don't recommend that you go out and do the pre-marketing. We'll show you how to find that during our training. That's why we give a money-back guarantee at the end of the week of training. If you don't like what you've heard the whole week, then you just ask for your money back. We'll talk about that here a little bit more. Okay.
One more thing, Patrick.
Yep.
Brad's asking a question about billing codes. Are they standardized? Do they cross state lines? You want to address how those codes are real quickly?
They're one set of codes. Actually, there's two. One is the ICD-9 that we talked about, and then soon to be 10. Those are the International Classification of Diseases that the World Health Organization came up with. So yes, they're standardized. Every doctor in the United States uses the same codes.
Excellent. All right, so we talked about doing a live demo. Now, folks, we can do a live demo for you before you become a licensee. So if you really get this understood, but Patrick, this is something that we continually do for when they become a licensee in order for them to get their clients, and this is one of those support mechanisms that we help with our licensees.
Yeah, and this is something you couldn't even put a price on this, folks. This is invaluable what we do for you. You set up online, we have an online system where you register the doctor that you're talking to that says that they would take a half hour or so to watch a demonstration. We set that up using GoToMeeting, so it's all done over the internet. You can be at your home office, the doctor can be at their office, and we do the opportunity demonstration of the system itself and how it will help the doctor collect more money. We do it for you. Our people do these. And Eric, the licensee illustrated here on the right, on the upper part of that, they can be watching this demo themselves and listening to exactly what's being said, all the questions that the doctor asks, and guess what? We answer all those questions. So they're just sitting there listening to. And of course, I think you put this in this slide here, Eric. You'll see it appear here. What is it that the doctor says as he's watching this demo more than anything?
Wow. And Patrick, I literally had that happen. Also, you're going to be trained by one of our licensees that has been out there for quite many years. Right. And her name's Cynthia Anderson. And Patrick, she asked me to do a demo for her for one of her new clients. And I swear to you, if that did not happen again, that doctor said, wow, I cannot believe it does that.
Yeah.
Because one of the questions I asked him, I said, how many demos have you ever seen of other software? He says, I've seen it all. I don't know if there's anything you can show me that I haven't already. I said, great, I'm glad to hear that. I may not be able to, but I mean, halfway through it, this is what the doctor was saying.
Yeah, it's because, folks, we do have the leading edge technology that's out there. It's because we want you to collect the most money, but we also want to show the doctor they're always interested in using the latest of everything. And we have the latest, and we keep up on that, and we upgrade our system almost weekly. And every time you log into the system, since it's cloud-based, that is, you just go to an internet browser and you go to the site that we tell you to log in with your password and ID. Every time you log in, you could be looking at new features because it's done, behind the scenes on our servers.
Exactly. Patrick, there are a lot of questions that have come in about marketing, about sales, and that. I'm going to post, everybody, if you'll see in your chat box, I am posting a link to one of our webinars that Patrick and I did a few months ago. I'm not a salesperson. What do I do? So I wanted everybody to get that before we got too close up to the hour so that you didn't have that available. So a lot of your questions about marketing and sales are going to be answered by that webinar. So make sure that you take down that link there for you. Okay, let's keep going.
Yeah, we try to limit these to an hour, folks, and that's why we're talking fast and moving through it pretty quickly. Here is, for example, an actual report. We have a spreadsheet that we put together with the right calculations behind it so that you, once you've done the practice analysis with the doctor or his office manager, you plug those numbers in here, and as you can see, bottom line, it shows you and shows the doctor exactly what you can do to increase their revenue. Bottom line is if the doctor thinks that you can bring in more money why wouldn't he at least try to outsource his billing to you? Those doctors who've already outsourced, by the way, are probably your best prospects, because many of them are not happy with the reporting that they get from their current billers. And we can give the doctor all the numbers they want, plus we can give him access to the system live from any computer device or iPad or even his phone. He can see the status of his claims 100% of the time. And it blows them away.
That actually helps answer the question that Tally was asking earlier. Tally was asking the question about, referring to a statistic that we were showing. Where did we get the source from? It said here to refer to the in-house billing versus ABS licensee costs, $65,000 versus $28,000. This is where we get this information. Like I mentioned earlier, that particular spreadsheet that we were showing you was actually data that was collected from something like this, a practice revenue report. So that's where we're getting this information from.
Yeah, because we get copies of these. Once our licensees prepare these, they'll pass this by our support department, and we collect this data, and that's where we came up with that kind of chart. You're right.
Correct.
So, folks, as you can see, we talk about a lot today, but we basically train you to become what's called a revenue cycle specialist. Every aspect of the doctor's practice that has to do with revenue, you're going to know how to help the doctor with that. That's why we came up with all the auxiliary services that we mentioned earlier, and that's illustrated here by these boxes. You can find out more about these in our virtual brochure, so be sure and ask your ABS rep to go through these, and you can ask all the questions about all these. Folks, again, the materials that are in our package are professionally designed. We've spent hundreds of thousands of dollars getting stuff ready so that it looks like you are almost a franchise. The advantage is you don't have any restriction on your territory. Your territory is the United States, and there's no royalties that you pay to us. Once you've paid our licensing fee to ABS, that's all you'll ever send us. You'll never send us another dime.
Exactly. All right. So, yeah, this is a great one. Don't take our word for it. Let's see what other licensees will say as well. So, Patrick, let's put it, all the licensees that we have up there. These are all these different people you have an opportunity to speak to and with. And actually, we've been able to add so many more. I think one of the things that we've done best here in the last few years is working very closely with our network of licensees. We've helped them get their business going. And it's this whole thing about reciprocity. If they've been helped, they want to help others as well. So remember, a lot of these licensees have been exactly where you are today on a webinar, listening to Patrick and me over several times, and they've gone through the whole process. They've come through training. We want to take you over to where you can go either listen to them. Patrick's showing you right there where you can go find out about our blog. This is where you're going to find out a lot about the other webinars, as I posted in the chat box just earlier.
Yeah, because on that blog, we post all of those interviews with the licensees that we're talking about, and you have to just go down to the bottom of the page and go to the previous page and the previous page and so forth, and you'll see it's just a ton of information that we've put out there over the years, folks. Okay, so here's one of the reasons why we think this is the best business opportunity in America, because Entrepreneur Magazine thinks that. Here's how we know that, because they have a book called Start Your Own Medical Claims Billing Service. And in the back of that book, in their resource section, they have a section on business opportunities. Well, guess what? We're listed right there. There's our current information, as you can see. And on the next page, there was one other company listed, and Eric, they're out of business now. So,
right.
Don't have a lot of competition out there if you want to do your research. And so, Eric, I think we're at the end here. Let's go ahead and talk about the money back guarantee. Folks, this is what we put in writing in the agreement that you sign, that any time during the training workshop, for any reason you don't think this business is right for you, simply tell any of our staff, and we'll arrange for you to receive a full refund. That's right. Every penny of the money you paid to us comes right back to you. I don't know of any other company in America that can do that, Eric. That's because we kind of know what we've got, and we know that it's good.
Exactly, and it's a fair thing. Folks, you've got to understand that we know that you are looking at this business through a webinar, on calls, you may have been able to take some time and have conducted a demo with us. We want that due diligence to continue on even through training. So that's why Patrick has that in there. If you haven't seen that in the purchase agreement, just simply ask for it. We will get you a copy of that pretty quickly and get that back over to you. So, Patrick, I mean, we're really up at the top of the hour. I think we'll take a few questions here, but I think you want to post the registration for next.
It's already in there. Everybody look in your chat. You'll see that little registration code at the bottom there. I've already put that link in the chat box. You can click on that right here at the end of this webinar and register for next week's webinar, where we'll go into detail how that ABS helps you to figure out how do I market these services to doctors. Folks, we've been doing this for 20 years. We've got this down to a fine art.
Okay, let's see what questions we can actually get to while you